Hello everyone, my name is Cyrille Touzeau from the University Hospital of Nantes in France. I have presented on behalf of my colleagues the results of Teclistamab in patients with relapsed or refractory myeloma following prior exposure to other B-cell maturation antigen targeted agents. And this has been presented during last EHA meeting. We know that BCMA represents an established target for the treatment of patients with multiple myeloma. Now we have three classes of BCMA-targeted agents, including CAR-Ts, antibody-drug conjugates, and bispecific antibodies. Teclistamab is a full-size, fully humanized, off-the-shelf BCMA-CD3 bispecific antibody that redirects CD3 positive T cells to mediate T cell activations and subsequent lysis of myeloma cells. The multi-cohort phase 1-2 MajesTEC-1 study evaluated Teclistamab in patients with relapsed myeloma who received at least 3 prior lines of therapy. In cohort A, patients without prior BCMA-targeted treatment exposure, Teclistamab resulted in very high response rates and a median PFS of nearly 1 year, and these results have been recently published in the New England Journal of Medicine. Here we present the efficacy and the safety results from cohort C of MajesTEC-1 that enrolled patients with prior exposure to BCMA-targeted treatment. So this is a design of MajesTEC-1. So in cohort C, patients had measurable relapsed myeloma with at least 3 prior lines of treatment. They should have received prior proteasome inhibitor, IMiD, and anti-CD38 agents. And in cohort C, patients should have received prior BCMA-targeted treatment, CAR-T, and/or antibody-drug conjugate. Patients received Teclistamab 1.5 milligram per kg weekly after step-up doses. And treatment was given until disease progression. And the primary endpoint from this cohort was overall response rate. This is the patient characteristics. 40 patients have been included in this cohort. The median number of prior lines was 6. Most patients, 85% of patients, were triple-class refractory, and all patients received BCMA-targeted treatment. Most patients, 29 patients received prior ADC, and 15 patients received prior anti-BCMA CAR-T, and 4 patients received both CAR-T and antibody-drug conjugate. This is the primary endpoint, overall response rate. The overall response rate was 52.5%, and this response rate was similar in patients with prior ADC exposure or prior CAR-T exposure. In the 4 patients who received both ADC and CAR-T, 3 patients achieved at least a partial response. MRD negativity was measured, and 17.5% of patients had MRD negative disease at the threshold of 10 to the minus 5. This is the durability of response. The median follow-up is nearly 1 year. Response occurred early and deepened over time and were durable. The median time to first response was 1.2 months. The median time to best response was nearly 3 months, and the median duration of response was not reached. This is the overall safety profile. The safety profile of Teclistamab was as expected based on the broader MajesTEC-1 data. Teclistamab was well tolerated with no dose reductions or discontinuation due to adverse events. We have to note that infection occurred in 65% of patients with 30% of grade 3-4 infections. Cytokine release syndrome. Most patients experience CRS, as in the cohort A of MajesTEC-1, but all events were grade 1 or 2 and resolved without treatment discontinuation. Neurotoxic events. These events were quite rare. 10 patients experienced neurologic event. the most common adverse event was headache in 12.5% of patients. Only one patient had grade 3 ICANS that resolved in 2 days with supportive care. So to conclude, serial targeting of BCMA with Teclistamab following treatment with an ADC or CAR-T resulted in a promising response rate and was well tolerated in patients with heavily pretreated relapsed myeloma. And this data support Teclistamab as promising new off-the-shelf T-cell redirecting therapy for patients with relapsed myeloma with prior exposure to BCMA-targeted agents. Thank you for your attention.